It doesn't hurt as much as you think, and the recovery is not going to be as bad as you think. I know you hear a lot of things from other people and you see things online, but that's not you. And every experience is different, and unfortunately, the worst ones always seem to end up online. And what I don't want to see is you not get all the right information to make an informed decision and not enjoy the benefits that you could feel and experience from addressing a problem that's bothering you. So let's start first with pain, and that's everyone's concern that comes in. How much pain am I going to be in? How long is it going to hurt for? I hate narcotics, or I don't want to take pain medicine. We hear it all. And so what we have found over the last couple of years is that a multi-modality approach works great. And we give you narcotics. I have been criticized before for saying we need to cut down on narcotics, and I've been told to go back to medical school because you need to treat pain. So we give you narcotics, but I do want to limit the amount you need because of the side effects and all the problems that come with them. So what we do before surgery is start you on gabapentin. You take one dose the night before surgery. I know a lot of people hate that drug and think it's bad and know it's not a pain medicine drug, but it does help decrease nerve sensitivity going into surgery. And it's actually originally an insomnia drug, so it helps you sleep the night before. In addition, we give you Robaxin, which is an antispasmodic drug that works through the central nervous system. It's not a muscle relaxant in the traditional sense. We give you Celebrex, which is a selective anti-inflammatory medicine. And we encourage you to take Tylenol. And the combination of these medicines really helps tremendously to stay ahead of the pain. Most of the pain that you experience with surgery is from inflammation. Things get swollen, they get tight, they get inflamed, and that's why they hurt. And we do give you pain medicine. So you have all of these medications available, but what I think the key is to start before you have the actual pain and to get on a regimented schedule where you're taking it regularly the first 5 days. And we've seen a huge improvement in pain control and a huge reduction in the need for narcotics. And remember, the sooner you get off the narcotics, the less side effects like constipation, upset stomach, issues sleeping, and you're able to drive when you're not taking the narcotics. So the sooner you can get off it, the better. The other thing that we do during surgery now is everyone that we operate on gets Exparel. Exparel is a long-acting numbing medicine. It's bupivacaine with liposomes attached to it. And what that means, basically, is that the drug hangs around a lot longer. So rather than the local anesthetic or numbing medicine wearing off in 4 or 6 or maybe 8 hours, this will actually last you 3 to 4 days. So you'll have the numbing effect for up to 4 days in some patients. Huge, huge, huge benefit to not having to need as many narcotics because you're not as sore in the area of surgery. And we use this on patients who are getting liposuction, facelifts, arm lifts, tummy tucks, you name it, we're using it. It's a little more expensive. It's a few $100s to the surgery cost, and we actually don't charge you for it. Originally, in my old practice, we did, and I just thought, I want people to take this, and for a couple of reasons. Number one, you're a lot more comfortable as a patient. You're going to have a much better experience. And actually, when you're in less pain, you heal better. You have less vasoconstriction or tightening of the small blood vessels, so you actually heal up much better and quicker. And I'll tell you, honestly, a selfish reason is I get a lot less phone calls about pain issues and questions and issues about medicine when you're comfortable. And so the more comfortable we send you home, the more comfortable your recovery, the happier you're going to be, and the more likely you are to tell other people it's not as bad as you might hear or think. One thing I do recommend with medicines, though, I think it's really important to plan ahead. I think you should take the medicine and the doses that you're going to take at each scheduled time interval and put them in a little baggie and line them up, put a little piece of paper in, mark them, so that once you're home after surgery, you don't have to think. And the person who's taking care of you, who may not have a strong medical background, isn't overwhelmed. They're able to go to the baggie, see the last dose that you took, and they'll know what the next dose is. And I think it's really, really important that first 5 days to stay on that and to really be regimented in how you take the medicine. I think you're going to be much happier, and I think you're just going to go through the process in a much better way. And overall, that's what we want. We want you to get great results. We want to meet your expectations, and we want it to be a really good experience for you. So that's the pain part. The recovery part is equally kind of, I think, blown out of proportion in a lot of ways. And I will tell you, I will get criticized. People will say I had a tummy tuck and it hurt for months. There are those folks who experience that unequivocally. But for every one of those types of patients with that experience, I can give you 5 or 10 other patients who had a much different experience. I have had a teacher last summer go back to setting up her classroom in August in 8 days after a full mommy makeover. She had a tummy tuck, liposuction, breast lift, breast implants, and some bra line lipo. She was the exception, and I don't recommend that, and I was trying to slow her down a little bit, but it's doable. I think what we see is how you come into the surgery, the mindset, your physical activity level, how good of shape you're in, and just your outlook on life in general. The people who have that upbeat, I can do anything mentality cruise through. And the folks who don't find it more challenging. Now they recover, they heal, and they do great, but the process is a little bit more complex and it's a little bit slower. We put restrictions on you based on the procedure you had done in the area of your body that was operated on. So liposuction, there are basically no restrictions. It's done through tiny little holes. There's no suturing of those holes. They drain a ton the first day or two. It's a mess. But there's nothing you can do to hurt that area. If you want to go back and work out in a day or two, you can do that. You're going to be sore and you might be a little crazy, but you can do it. We're not going to restrict it. You can't hurt yourself. If you've had a tummy tuck and we've plicated the muscle, it's going to be more sore. Things that involve muscle and bone, for the most part, are more sore. So when we plicate that muscle, you're going to be tight. You don't realize how much you use your core to get up out of bed. When you sneeze, you cough, anything like that. So those first 3 to 5 days are pretty sore. Usually by about 2 weeks, most patients can go back to non-physical type jobs. And again, teachers are a great example. They get up in the morning, they get themselves dressed, they drive to work, they stand most of the day, and they come home. They can usually do that at about 2 weeks. They're not doing physical activity, they're not lifting heavy weight, but they're going through a full day. Now, I will tell you, you will be exhausted at the end of that day. And what we see is a lot of folks wake up in the morning feeling great, a week or two after surgery, but by lunchtime, they're crashing and they're tired. And even if you're the healthiest, fittest person, surgery takes a lot out of you. And a lot of patients are surprised at how much more tired they are than they thought they would be. And your body's in an inflammatory state and it's trying to heal. That's why protein is so important. You're breaking down tissue to heal. There's inflammation. You're tired. Listen to your body. It's not a race. There are people who are going to be ahead of the curve and some behind. It doesn't matter. As long as you heal, you're happy, and we meet your expectations in a safe way, that's all that matters. So in terms of things like arm lifts, leg lifts, where we're basically just excising skin, by 3 weeks, that's usually pretty well healed, and you can do most activity, and at 6 weeks, you can go back to full unrestricted activity. That's the case for pretty much all of the surgeries we do. At 6 weeks, even if you've had a tummy tuck, you can do sit-ups, crunches, planks. If you've had breast surgery, you can do push-ups and things like that. In terms of breast surgery, it's a little bit interesting. It takes 4 months for the breast to settle, for the inflammation to basically end up where it's going to be, and for you to have sort of the shape and position of your breast. At 6 weeks, if you've had implants, at 6 weeks, the capsule has formed around the implant, and the implant's in a pretty good position, and we let you go back to normal activity. Now, some folks will say the skin heals much quicker, but it's not the skin that's holding the implant in place. It's actually that capsule, and that capsule takes about 6 weeks. The other thing is I'm happy for you to walk as much as you want right after surgery, And I'm happy for you to go back to the gym and exercise, as long as it's not impacting or affecting the areas that we worked on. And we're seeing you after, and we're guiding you on that. But this idea that you're going to have surgery and not do anything for 6 weeks, it's false. I want you to be active, especially if you're somebody who's used to working out. It's hard. If you're used to running, if you're used to working out every day, there's nothing you can do that's worse to a person than tell them they can't do anything. So I want you to be active, happy. I want you to do things like be up and walking. It prevents blood clots. It helps respiratory in terms of, pneumonia and atelectasis. All of these things benefit from you being up, eating and drinking high protein diet, but not overdoing it. And that's usually the problem, where ironically most people come in worried about the recovery and the pain, and a week or two later I'm worried about them doing too much, because you feel better quicker than you thought. You forget that you actually had something done, especially breasts, 3-4 weeks after, you're not feeling a whole lot. So you still need that 6-week period of not doing crazy lifting, straining. But because you feel great, you start lifting, you start reaching, you start doing things just because it's natural. So usually we're trying to slow you down on the recovery side, just because it's usually not as bad as you think. So we will control your pain. I can almost guarantee you, as much as I can guarantee anything, you will have less pain than you think you will. And your recovery will be easier than you think. So come in, let's have a conversation. We do virtual or in-person consults. Even if you live somewhere else, even if you're going to somebody else, let's talk. I love talking to patients. I want you to have a great experience with whomever does your surgery. It benefits us as a profession. I want us to make people happy. I want us to be respected. And I want us to just do good work and make people happy.